This is a picture, since most of you will be seeing once you pick up an ophthalmoscope in your hands, all your diabetic patients with diabetes that are not controlled. You see in the middle these yellow dots. This is called drusen. What is drusen? It's nothing but exudates. Exudates that come off the blood vessels. If it is leaking from these blood vessels, it is also leaking in your gut. So all patients with exudates have leaky gut. Once you start treating the exudates, the leaky gut, automatically the exudates go away. You see these microbleeds? These microbleeds, that means his endothelium is not functioning properly. The retinal vessels have a single layered endothelium. All the other vessels in your body have triple layers. So if something is wrong, it will break the first, second, and third, and then you will come to know. But since the vessels in the retina have only a single layer endothelium, if there is a small change, it will come out and you'll see a bleed. What is the normal story? You go to the VR surgeon, and what does he do? Argon laser. He lasers it. That's not a treatment. That's treating only the symptom. The treatment means you have to treat the endothelium. How will you treat this endothelium? You give him nitric oxide. You start him on chelation. Okay, and your entire other treatments that you were talking about. This case came some days ago. There was a girl who was 25 years old with leukemia, suddenly got blind. This is a picture of the optic nerve. You can see there's a lot of optic nerve edema. And there is bleeding around the optic nerve. That means there is increased intracranial pressure. For how long can you keep on tapping the person? For how long can you do CSF taps? How long can you give melatonin? Not melatonin. What's that? Pardon? No. No, for decreasing the mannitol. How long can you give mannitol? Good, nobody's sleeping. I thought everybody slept, even with lights off. How long can you give it? Because your Dimox causes decrease in potassium. So you have to give potassium along with that. So you have to decrease the inflammation. And how will you decrease the inflammation around nerves? Give them good fats, give them MCTs, give them trocotinols, good vitamin E's, good linoleic acids, good omega-3s. Otherwise, in cancer, they say, she's blind, go home, just continue chemo.